Hi, Wendy.
Hi. Oh, nice
Hi.
background, Chris.
Like that,
Chris,
eh? That's real time. That's real
meet
time
Chris.
Canada. Hi,
Hi.
Chris.
Hello. Can you hear me? Is it? Yeah. Hopefully it says
Yes,
that
I
it's
can hear
working on
you
my end.
loud and clear.
Lovely.
I've made both of you co-hosts. I'm not sure if you have any slides.
Yeah, I do. Yep.
Okay, fantastic. You should be able to share them now. We've got Kevin Liu has joined us. Hi, Kevin. Thank you for joining.
Hi, Kevin.
Yeah, perfect. And so with that said, maybe we'll just get right into it. Appreciate just lay some ground rules, I guess, for Kevin. I think you've probably heard this, Kevin, already, but we're trying to stick to the 15-minute time limit out of respect for all of the sessions that runs consecutively. And so there'll certainly be opportunity if we don't get to answer all of your questions, or if Chris and Wendy don't get to answer all your questions about the JCU physiotherapy program, there'll be opportunity to go to the JCU booth afterwards or the OzTREKK booth. And so with that said, I will pass it over to our friends at JCU. And I just want to make a point that the student experience at JCU is phenomenal. And students love going there, whether either campus they go to, and the people there are fantastic. So with that said, I'll pass it over to Wendy and Chris.
Thank you.
Chris, I'm just here for moral support, so you please go ahead.
Not a problem. I guess before I get started, Kevin, do you mind if I ask kind of what your background is? Are you in high school? Are you looking toward going to university? Are you graduated? Are you working in the university realm? Just so I can kind of tailor and answer your questions, hopefully a little bit more directly, that's all. All right, then. Well, we'll get into it. I will share my screen. Bear with me. All right, there we are. All right. So, physiotherapy at JCU. I've been teaching here for a few years now, up in Townsville in North Queensland, Australia. Within our College of Healthcare Sciences, so our faculty per se, we've got a number of different allied health sections and courses that you can look at. I'm not going to touch on occupational therapy or speech pathology today, but it's important to acknowledge that they're here, they're under the same building, and we share a lot of the same kind of first and second year subjects, given that we kind of then branch off into our own respective areas. What do we actually do as physios? Well, within Australia and worldwide for that matter, we actually work at looking to assess, diagnose, treat, and work to prevent disease and disability through physical means. We work in a variety of different areas, and quite often the one that's kind of acknowledged very quickly is your private practice realm, working with sporting conditions and injuries, athletes. But we actually, as physios, work in a number of different areas. So we work within the neurological realm, so people post-stroke or Parkinson's disease, multiple sclerosis. We work within a cardiorespiratory section, so looking at people after they've had surgery or chest infections. We work in ICUs, we work in emergency departments, we work in kind of, all the way through the lifespan from, infants all the way until you're at death's door. So physiotherapy gives you a lot of flexibility. And obviously, depending on where you're situated, whether it be Australia, Canada, or anywhere for that matter, your roles and your ability are going to change based on nation-to-nation requirements. So why JCU physiotherapy? We've got a few things going for us. You'll find that a lot of the schools of physiotherapy across Australia will have some form of undergrad musculoskeletal clinic. We've got that, but we've also got an interprofessional clinic. So what this means is that we actually work alongside those other disciplines, plus a couple of more that I mentioned before. And we work with people with lots of complex conditions and things going on. And we do that in one of the facilities that you can see on the screen there. And we allow the students to actually be able to come through and do observational and hands-on placements pretty much from that first semester of their 4-year degree. Now, when we're looking at this, other aspects that are really important that our students have provided, positive feedback is that we actually have a mentoring system in place from first semester, first year. So we'll pair up our students in the sense that they'll actually get to go to classes and given guided tours with second and third year students. And then we also allow them to go to a mentoring based program. So it's called our PASS program. So that's where they might have physiotherapy or kind of anatomy or physiology questions. And they're on top of their normal classes with their normal lectures or tutors, they're able to go in and have a second or a third year student tutor them through the content and have that peer-to-peer based system. Those students that are doing that or giving that support are reimbursed for it. But we find that our first year students really find that beneficial talking to someone who's gone through it just the year before. Now, our class sizes are generally quite small. When we're looking at that, we probably be between I think the lowest we've had in recent years is about 14 per class, and the highest that we've had per class is about that 21, 22. Now, that doesn't mean your cohort's that big. Your overall cohort can fluctuate. So we generally say between 60 and 90 students per cohort, but we cap those class sizes just so that we get a little bit more time with each student to make sure that we're actually, getting your technique correct, that we're actually able to address and answer your questions. So this means that as well, we all know your name. We all kind of get along fairly easily because, again, we're all under one roof. We do have a rural and remote focus. So we do focus on the tropics. We do focus on healthcare across multiple different settings. In Queensland, we are the largest tertiary hospital outside of your Brisbane, Southeast Queensland area. And as a result, we do have a lot of kind of emergency and a lot of interesting cases come through. So that does provide our students a really good learning opportunity that wouldn't be afforded elsewhere. Now, in terms of actually getting in from high school, there's a number of things that you do need to consider. I'll talk about alternate pathways shortly, but with our degree, it's a 4-year degree and it's all based here in Townsville. Now, I say that in the sense that we don't offer the course elsewhere, but when our students are out on placement for that 1 year of the 4, they will be expected to travel around Queensland, sometimes outside of Queensland. So Queensland is a state in the north eastern part of Australia. We often have students go to the Northern Territory, to New South Wales, a couple to Victoria, and every now and then we'll have a couple go down or over to Western Australia. Now, with the global pandemic that's going on at the moment, some of these placements are changing, and some of the things that we've been afforded in the past, we're having to be a little bit careful with just to maintain safety for everyone involved. So our placement opportunities previously overseas, where we were looking at places such as New Zealand, Cambodia, Spain, Vietnam, have had to be reeled back in. And we do hope that in the next couple of years, when the borders start to reopen, that we'll be able to actually look to send our students out on placement there. Now, in terms of what's required, we do require a fairly high level English, what you typically identify as like a mid-level maths, and we do need a science. Now, the science can be biology, chemistry, physics, or it could even be physical education or health, as long as you cover some form of science component in there. So human physiology or anatomy is a perfect example. Now, a lot of students will get really worried as to whether or not one science is better than the other. We find that students that do biology will excel in those first few weeks of their first semester, because you do go over your anatomy, your physiology with much greater depth. So they get that head start. But in terms of what happens at the end of the semester, at the end of the year, at the end of the degree, we found that there's no difference whether or not they do biology in terms of their grades and success. We do find the same with physics. So obviously there's when you're talking about physics at high school, we don't necessarily relate it to the human body. We usually talk about it in theories and principles and moving objects such as cars and wheels. But we do apply those physical principles to the human body. And again, students find that quite beneficial when we're talking about the movements, so the kinetics and the kinematics of movement. But again, we find that it just gives them the head start. It doesn't necessarily mean that they're going to achieve at a higher or better rate. Now, our entry requirements change year to year. And the reason that they change year to year is that they're based on competition to get in. and what's going on across the health sector and the university sector in general. So previously we used to operate on what's called an OP system. I'm not going to talk about that anymore, but what I am going to mention is our ATAR system. So you're able to achieve a score of up to 99.99 out of 100. And our students, to get in or to be competitive, you need generally around the 84 to 85 mark. It does fluctuate, might go up or down a couple of points per year. And that's something to keep in mind for the year that you're applying in. So for Canada, usually we say that it would be about 80%, and that's based on the average of the best 6 Ontario subjects as a percentage. So if you're not based in Ontario, you're going to have to find an equivalent. This was the most readily accessible information that I had on hand that I could find that was reliable. We do require people to apply in by the last working day in September as well for the following year. If you do go in and are offered a place, you also are able to defer for up to 12 months just to give yourself time to maybe save money or to get a little bit more life experience or to work out if that's actually what you want to do for you. Now, our course is spread out over 4 years, and this is how our honours program is broken down. So with our program here, we don't have honours included in every single student's enrolment. What we do have is the opportunity after their second year, pending grades, to be offered an embedded honours project. So this is where they're then given a one-to-one supervisor, so myself or one of the other staff members, for example, and they're able to actually do some form of review of the literature, or they're actually able to conduct some form of research, so hands-on case studies. We've had multiple different types of studies come through in recent years. We've had students working with people with Parkinson's disease, looking at sporting injuries, looking at different types of assessments for athletes as well. And quite often these students that go through and do these projects will go on to publish them, which is something that's really cool, I think, and also obviously also really good for when you graduate as part of your resume. Now, this is an example and a breakdown, and it's available online on the JC website under the physio part of the website. These subjects are subject to change a little bit in terms of the content that's in them, but this here is pretty much what you'll get. You can also click on these online and it gives you a further breakdown into what the subjects entail. Our first year is generalized kind of health, and we're looking at some things around our actual healthcare systems, what's required for a general health professional, then breaking it down into physiotherapy specific skills. And that is broadened into our PS-based subjects that you can see in our year 2 study period 2 in particular. And then that obviously extends into our 3rd and our 4th year. So you go very general to begin with, and then you hone in and get very specific to physiotherapy. Now, just to give you a bit of a breakdown in terms of some of our students that have come in from the past, the most reliable data that I could have or could get hands on was back in 2018. So if we're looking at our intake, so we only have 1 intake per year at the start of the year, usually in about February, end of February. We saw quite a number of students coming in. So a lot of people, they had some form of higher education study before, and then we had also seen a lot of students coming in from high school. So these are typically the areas that people come in, but we do get what's called mature age students, where people have taken a year or 10 off, and they've actually gone in and used that as part of their application. So that's something that's possible. Now, you'll see that we don't have any international students having come in from 2018. That's probably the only year that we've had none. In 2019, we had a handful. In 2017, we had a handful. And we usually operate between about 3 to 5 students per cohort. So when we're having a cohort of 60 or 70, it does make up a small proportion. Where do they come from? We've had graduates from Canada, from Spain, from India, Malaysia. So a multitude of different areas across the globe. Now, I did mention before about looking at different pathways. So here, if physiotherapy is something that you're interested in, but potentially haven't done the correct subjects in high school or gotten the grades that you wanted to, then we do have what's called a diploma of higher education, where you're able to move in and go through there. So again, there's a little bit more information online. I'm not going to go into too much depth around that, but I think it's something that's also really useful for any type of health science at JCU. Now, specific to Canada, how am I going for time, Chris?
Hi, Chris. It's kind of Kevin just left,
All right.
so I don't want to like obviously waste your time.
No, that's okay.
Yeah, so I wanted to give you the heads up on that.
That's all right.
Yeah,
I'm happy to call it there if you like.
yeah, I think so. Look, I appreciate you giving the overview. I know this is a market we're trying to develop with Wendy in Canada, and it's it's going to be a slow burn. But it's what I love that we're giving it a shot, and I love that you're willing to help. So
That's all right.